All right, so when we look at the skull, I think it's generally easiest to start with the thing that we're most familiar with, our face, right? So we're going to start off looking at like the brow area. This is the frontal region, surface anatomy, and if you know that, you already know the bone name, right? Frontal bone. So the frontal bone on people will have either a hole or like this, a notch. This is in the orbit, which is the ring that we have right here, and this is on the top of it. So we say it's the supraorbital notch or supraorbital foramen. I think most of our skulls have a notch, but you might see a hole too. I accept by the name. The frontal bone doesn't have a lot of features. So it's got a sinus in it, which are what you see these bumps in the brow ridges. You can feel them on your own, like right under your eyebrows. So that's where the frontal sinus is. There's one on each side. You get a headache like right above your eyes. That's like a sinus headache right in that space. It's that frontal sinus. Something's making it hurt, usually an air pressure difference. As I go inferior on the anterior surface of the facial bones, what I'm going to then hit is the orbit. That's kind of the big distinctive thing we see here. So the bony orbit is all of this. It's also called the orbital region or ocular region. The eyes would be when we talk about optics. So with the orbit, there are four bones that make up the outer rim of it. The frontal's the superior one. Laterally, we have the cheekbone, the zygomatic bone. Inferiorly, we are then going to have the maxillary bone or the maxilla. Either one's fine. And then medially, we're going to have the lacrimal bone, which I can usually find on a real skull, a hole that goes through here, or often on these, just a little depression. And that's called the lacrimal foramen. And that's kind of the difference between like a $500 model skull versus a skull that comes in a $100 skeletal kit, is they bother to put the holes where they need to be. So we'll see some of those. So most people won't have a actual like hole through there. You just have a little divot. So there's a fossa, which is like a shallow lake bed on the surface of a bone, the lacrimal fossa that leads to the foramen. That hole then leads to the nasal cavity. Nasal cavity is normally divided in half by a piece of cartilage that runs through here. That cartilage combined with the bone makes up the nasal septum, and that's going to divide you into a left and a right nasal cavity. So your tears leak through that hole in the lacrimal foramen. They then go into the nasal cavity, which hydrates all the mucus and boogers you have in there, which is why you get all snotty when you cry or have like, allergies or get maced if you happen to run into one of those. So the idea then with that is that normally I'm producing tears. They wash across my eye and just drain, and it's such a small volume I don't notice. My nose doesn't just run, but when you do get extra leaky, you will feel that. So our orbit is made up of 4 bones on the rim, but there's going to be 3 more bones as I go deep inside here. And so as I look inside the orbit, on the lateral aspect of it, well, actually if I kind of get a good view right here, you can even see light coming through. So this is the floor of the cranium. We're seeing where the brain's at. So that's the frontal bone still in there. But as you go further back, what you're going to find is that the sphenoid, like Sphinx, SPH, makes an appearance in here. This is a really good time to look at one of the colored skulls if you have one, or the drawing in the lab manual that shows each bone a different color, because the sutures are very difficult to spot in this. Now, if I were to just pinch this bone, the skull, a little bit posterior to the lacrimal bones, then I am pinching the ethmoid bone. This is a very light bone. It's mostly air spaces in it, the ethmoid sinus. This is like if I'm holding the skull if it's kind of icky. If I were to go bowling with the skull and really reach down in there, still grabbing the medial aspects of the orbits on both sides, then I would be touching the sphenoid bone. And the sphenoid is actually going to wrap kind of all around inferiorly. You see it superiorly, you see it laterally too. So it makes up a lot of that posterior lateral medial wall of the orbit. So that's 6 bones: frontal, zygomatic, maxillary, lacrimal, ethmoid, sphenoid. There is a 7th that we cannot see on the model because it's just a tiny, tiny little jump or bit in there, and that's the palatine bone. It gets its name from being your palate, right? The roof of your mouth. So it goes from the posterior part of the roof of the mouth. It has a little extension that goes all the way up to the back of the eye. People forget that it's there. So just know that there are 7 bones in the orbit. 6 of them are really easy to see. The 7th, the palatine, is kind of easy to forget because it's just a little tiny nub way in the back. Now when I look into the orbit, I can see some holes back here. And like most of my other bones, when I have holes or bumps or rough spots or processes, I'm going to bother to name them. So if you are from the outside of the skull able to put, I'll use a colored one for this because it'll show up better, able to put a straw through there or a wooden stake, if it's going from the outside, right, this is like below the cheek, then you have the inferior orbital fissure. If you are going from the inside of the skull, there are two possible ways to get in the orbit. One of them is the superior orbital fissure. And if you look at the skull, it almost looks like the superior and inferior are connected, making a V, but they are different because one doesn't actually open up to the inside of the cranium. The other opening that we have, and I'll leave that in there so you can see it, is the optic canal. And that one is the little circular hole that you'll see in the back of the orbit, as opposed to the crack, which is a fissure. So we have three openings, superior and inferior fissures, orbital fissures, and then we have the optic canal or optic foramen too. Now, as I go from the orbit, one thing to keep in mind too, just fair warning, the nasal bone, which is right here on the brow of your nose, these bones are not part of the orbit. They look really close in humans because our face is so squished as we've become more upright. But you look at other animals and their noses are more extended out. The nasal bones are very far away from the orbit, which is why we don't consider them part of the bony orbit. Just the lacrimal. So as I go inferior from these structures, I'll see that nasal cavity again. I have a bone that divides it in two. This is actually two bones that fuse together. The superior portion of it is the bottom of the ethmoid, the inferior extension or process that comes down from the ethmoid. This is kind of like, so I think about this like the ethmoid is a sailboat. And from the bottom of a sailboat, you have a keel. So that keel is what we're seeing in the skull right here coming down from the ethmoid. That keel is going to help anchor to another bone that we see coming up from the bottom or inferior aspect of the nasal cavity called the vomer. The two fuse together and form the nasal septum, the bony nasal septum. You also have like that flexible cartilage on the front of it too. The ethmoid can also be seen here and here. Focusing is a little touchy on this. There we go. Here and there. And then you will have this ridge that comes off the wall here. Now these are all called nasal concha, but your middle and inferior ones are their own bones, whereas the superior one is part of the ethmoid. They help to mix the air up when you breathe in through your nose by having that rough structure there. It creates more turbulence, which helps you smell and humidify the air. Now to either side, if we go lateral, away from the midline on this, to either side we have another hole. That's going to be the inferior orbital foramen, same way we had the superior orbital foramen or notch above it. And this is definitely in the maxilla now. If I were to like punch a hole through here, I would go into the maxillary sinus, which if you get like a sinus headache, usually, congestion, like in your cheeks, that's what you're feeling is that maxillary sinus. So we have a sinus in the maxillary bone, we have a sinus in the ethmoid, we have a sinus in the frontal bone, and when I go really far back, I'm going to have a sinus in the sphenoid bone. Those are all hollow spaces within the bone that are going to help lighten the weight of the skull, and they help our voice resonate. And that's why like your voice sounds different when you have congestion. So then I go down and I have this ridge that kind of sticks out. So you almost like pinch it, that sticks out from the maxilla. That's going to be the alveolar process or alveolar ridge, and all your teeth fit into that. So rather than think of the teeth like pushing into the maxilla, think of like the maxilla is like this flat thing, and then you molded some bone out to cover the teeth. And that's why it's a process or a ridge rather than like they're poking into it. So then I want to do the lateral side. not supposed to be automatic, but it is doing the automatic. So in the lateral side, frontal bone again up here. As I go posterior, I'm going to see this little ridge. I can kind of hit it with that wooden stick. You can feel it. So that is the line between my lateral parietal bones, which are all over here. And you'll see those if you put the skull cap back on a little bit more easily. Frontal bone is here. There's a suture that runs up, the coronal suture right there. So then the parietal bone is right here, and then this is the temporal bone, and the squamous suture separates the two of them. The temporal bone then extends down. There's a little suture that runs through here. So this is actually the sphenoid. We'll be able to see the sphenoid from every angle on the skull just because of how like weird it is, and it kind of glues all the bones together in the front half of the skull. Temporal bone here. This temporal bone is going to have a process. That's a bony extension that extends outward and anteriorly, so laterally and anteriorly from the temporal bone towards the front of the face. It's going to meet a piece of the zygomatic bone that extends posteriorly. And so you see a little line right here. So what we have is a piece of the zygomatic bone that goes to the temporal bone and a piece of the temporal bone that goes to the zygomatic bone. We name them that way. It's confusing until you think about what the name is telling you. So on the zygomatic bone, I have the temporal process. That's telling me it's a process from the zygomatic bone, an extension, that goes to the temporal. And on the temporal bone, I have the zygomatic process of the temporal bone. It's telling me it's coming from the temporal bone and going to the zygomatic bone. So it's a mouthful, but it's telling you exactly what it's doing. Together, like the nasal septum, we now form a structure. This is called the zygomatic arch. And you can go right through it. This allows a muscle that is attached right here to send fibers down, and then another muscle to grab onto the arch and send fibers down. So when you feel below your cheekbone and clench your jaw, that's the masseter. If you feel above your cheekbone and clench your jaw, you'll feel it flex there. That's the temporalis muscle. They both help you chew. So if you ever looked like a beaver skull or a bear skull, they have huge zygomatic arches because they have big old muscles, meaning they have really strong bites. This is how like an anatomist can tell how strong a T-Rex bite was, looking at the structure of those bones. Zygomatic bone doesn't have much that we have to deal with on there. The temporal bone has more features on it, both laterally and inferiorly and superiorly. So laterally, we have this opening here. This is called the external acoustic meatus. We then have this bump. This is called the mastoid process. The meatus here, I almost poked it with the stick. That's your ear hole, the one you're not supposed to put things in, like Q-tips, because the tympanic membrane, the eardrum, is right in there. This little plastic thing on the skulls, this represents the cartilage of the temporomandibular joint. You've probably heard of TMJ. Like that's when people grind their teeth and then they can get vertigo or pain or clicking in that joint. So that cartilage is going to help you, this one and the other side, going to help your jaw articulate, move around. And if you grind your teeth, it wears that cartilage down and then they have to replace it, which is a really nasty surgery. Because it's so close to your ear, when it gets inflamed, that's why people get like tinnitus, ringing in the ears, and vertigo when that area gets just generally inflamed. The mastoid process, you can feel this, it's right behind your ear. This is one of the easy ones for muscles. We'll have to learn this in 232, but the muscle that runs from here to the sternum, it's called the sternocleidomastoid. Cleido means clavicle, so it goes from the sternum and clavicle to the mastoid process. So the names will come back even in 232. It'll help you to know this stuff. The little pointy one that's a little bit more medial than the mastoid process, that is the styloid process. A stylus, like the point on this wood thing, a stylus is like a quill, what they used to use to write with. And so since this looks a bit like the end of a quill, that's where it gets its name. If you have an Epson stylus, they're terrible printers. But if you have one, that's why it gets its name too. So that's it for the temporal bone that we can see here. I'll go to the posterior side because this is actually not a ton of stuff to do on this side. And on the posterior side, we're now looking at the occipital bone. It's joined to the parietal bone with the lambdoid suture. And then you will usually see that there is a faint ridge right here and right there that extend laterally. from this bump in the middle. And that's the main thing that we need to identify on this. You can feel the bump on the back of your head. You may or may not feel the lines that extend from it. The bump is called the external, because it's on the outside, occipital, because it's on the occipital bone, protuberance, because it's a bump. Right? Like, again, a mouthful, but if you learn the language, it's very descriptive. The lines are called superior and inferior nuchal lines, N-U-C-H-A-L. They're actually kind of cool. So you can look at Neanderthal skulls, and they have really exaggerated nuchal lines, which means the muscles that grabbed on here were really strong. So it tells you that they ran a lot, and that helps to support their head when they're running. It doesn't bob around. So it's one of the things they use to infer that like Neanderthals probably weren't just like, Ugg and TikTok that were just hanging out in a cave. They were probably pretty mobile, probably pretty good hunters. Kind of a cool little anthropology bits in there. So the superior ones are pretty distinct. The inferior ones, you may not find, this one doesn't have good ones. Some of the skulls have really good ones, but the superiors are usually pretty distinctive on this. I can see it on the video a little bit better for the inferiors than I can in person, really. So then I'm going to turn this around and have the skull facing anteriorly that way, posteriorly towards me, lateral here, right? So if we look at it from this angle, got the spring. So if your jaw, your mandible is still on, you can remove it. All you do is just unhook the spring. It's not hard, but just be gentle with it because it's meant to come off if you do it the right way. So what we're seeing here is the inferior aspect of the maxillary bone. There are two maxillary bones they fuse together, which is the line you see on the roof of your mouth or your palate. And then there's a single hole right behind your incisors, two front teeth, called the incisive foramen. This is what they'll try and numb if they're going to do work on that front area in your mouth. So like they'll try and get an injection right here. About 2/3 of the roof of the mouth is the maxillary bone, and then you'll get a line across here where you now have the palatine bones, which was the one we saw in the orbit, those little tiny ones. And then those on the back have the pterygoid processes. They go down. There's actually part of the sphenoid, but we'll see the pterygoid processes in there too. I think that's it for our terms. We can see the back of the nasal cavity. So normally your uvula, that little fleshy punching bag, would hang out right here. But without that soft tissue, we can see right up into the nasal cavities. So that goes out. There's also why, like, if you cough in the middle of like eating something, you can shoot chunks up into your nose because it's just a soft, fleshy flap that protects that. Then we have, as we go back down through here, we have a bit of the sphenoid, the occipital bone, which is over here. Temporal is lateral, and that's about it. So as far as the features on this that we need to know, so we have the foramen lassurum, which is the two big holes that are very medial and paired, and the foramen magnum, that is the big hole that we have on the occipital bone. So this is where your spinal cord is at. And then on either side of that, on the anterior aspect of it, is going to be the occipital condyles. A condyle is just a smooth, bony surface where you have an articulation. So usually these would be covered in hyaline cartilage, and so they look smoother than the other parts of the bone. So that just, when we call these occipital condyles, that tells us, oh, this is going to join or articulate with another bone. What was our bone that was right under the skull? Atlas, yeah. We then have, and this is why I got this skull in particular, because only a few skulls have this. So we will have two other holes that we need to know on this. If I turn this now so anterior is pointing towards me and angle it up, you see these big ones that are very close to the foramen magnum. The biggest holes that we have here, they are the jugular foramen. That's where blood drains from your brain. There are also two other holes, and they're hard to see. This and like that lacrimal foramen is, again, the difference between a $400 skull and a $100 skull. So it seems dumb. But this canal is called the carotid canal. So the jugular foramen is where you drain blood from the brain, whereas the carotid canal is where you feed blood, most of the blood, to the brain. Those you won't be able to see straight through as you look down because it goes into the bone and turns and then goes into the cranial cavity. So it's a bit harder to see a straight line through there. This is how I like to ask them too. Like most of the foramen, I will put something through it and then put a piece of tape. Or I might use like a pipe cleaner, you know, it's like flexible fuzzy things, and wrap it through and put some tape on it and say like, what passageway does this go through? So I want carotid canal for that. Or I do the same for, you know, what passageway, what opening is this for the foramen magnum? So again, back to the skull facing away from me. This is easier if within your skulls if you kind of angle them the same way, because that way you see what's up here. So this is the cranial cavity. It's one of our body cavities. This was one of the two that made up the dorsal body cavity. The brain is in here, so you have your cranial bones, which are all going to be like touching the brain, and you have your facial bones, which you went over, that don't touch the brain but are part of the skull. So as I look at this, I have the frontal bone. Just below here would be where I'd find those frontal sinuses. And as I go into the frontal bone, it's not all frontal bone here. This middle portion right here, this is going to be the ethmoid bone, and there's a little spit of bone that sticks up from it. So if I go back to my drawing of my sailboat, right? My ethmoid, it's kind of like the boat. I mean, the whole thing's the ethmoid bone. That's like the body of the ethmoid. The sail, this is the crista galli, which means like rooster's crest in Latin, because it looks a bit like a little crest that comes up. And then this was the perpendicular plate, or the keel, right? The perpendicular plate of the ethmoid. So what we're looking at here is the floor of the cranium, and you have the sail sticking up, the crista galli. So that's what I can feel right here in there. On either side of it is a plate that has holes punched in it called the perforated plate. And this is how nerves from your nasal cavity make it up into your brain, as they go through those little tiny holes. And so that connects that part of your brain that's involved in processing smell to the actual sensory structures in the nasal cavity that do that. And unlike what a lot of people think, it's not your whole nasal cavity that's full of like smell receptors. It's just the very top portion in the medial part, right by where the other side of this plate is. So then if we go back, if you look closely, you'll see a little line. That line is going to tell us between the boundary between the frontal and the sphenoid bone. And the sphenoid, it's like a butterfly. The big wings are here, and the little wings are here. And so they call those the lesser and greater wings of the sphenoid. And then it has a little saddle. The saddle is where the pituitary gland sits. And then on the anterior part of the saddle, you have that circular opening we saw in the orbit called the optic canal. So when you look at something, like we think of our eyes pointing out this way, draw a straight line out from your nose. Everything on this part of your visual field is processed on the right brain. Everything on this part is processed in the left brain. So for the right optic nerve, which goes out on this side, that means that a lot of the visual field from here has to cross to the other side of the brain. For the left optic nerve that's looking out that way, a lot of the visual field here has to cross to the other side of the brain. But if you close your right eye, you can still see past your nose. So that means a little bit of each nerve stays on the same side that it was on, but most of it crosses to the other side. Because of that, we see a little groove between the optic canals that allows that nerve to cross over before going back to the back of the brain, and we call that the optic chiasm. And so it's there because we share some of what we call our visual field with each side of the brain. This little groove right here is called the sella turcica. It means Turkish saddle, like the little saddle that the pituitary is sitting in. We see the foramen lacerum again, and the carotid canal. Again, I can't see through it because it's like a little cave that winds through there. I see the jugular foramen again. and I see the foramen magnum again. So you can see those from each side. When I have this on the quiz, I'll have the pipe cleaner through it, and you can pick the skull up. So you don't have to. It helps to know what both sides look like, but like you can look at it from underneath if that's the way that you study more. And I think that is all or almost all the structures for it.